The term competency is used to describe the ability of a patient to be able to make informed decisions regarding their healthcare. A competent patient has the right to make informed decisions to refuse treatments, including life-saving treatments. A patient is presumed to be competent to make informed decisions unless there is reasonable grounds for believing that the patient is not competent. Reasonable grounds exist for determining this patient is not competent if the patient appears unable to understand information, appears unable to understand the consequences of their decisions, appears unable to remember information, has attempted suicide, or has expressed serious thoughts of attempting suicide. Cognition is a term referring to the process of knowing. Cognition includes both awareness and judgment. In the medical industry, paramedics will assess cognition to decide what level of understanding and comprehension the patient is experiencing. Common tools paramedics use to assess cognition is the Glasgow Coma Scale. This is a universal scale to measure a person's level of consciousness and awareness.
So Scott, I think it would be a great idea for you to come with me to the hospital just because you do not meet the checklist of my seizure non-transport checklist.
Right.
So just because there has been a seizure after a head injury and because there's no other adults here that I could leave you in care with, I feel like it's the best idea for you to come with me to hospital.
Oh, I really can't be bothered going to hospital there.
Yes, I know it can be a hassle waiting in the waiting room and all that sort of thing, but because of the type of injury you've had and the seizure, I do believe it is in your best interest to come with me to the hospital.
I'd be full of COVID and stuff, I don't want to go. I want to stay here, to be honest.
So you are aware that you don't want to come. Do you believe? Do you know the risks of your injury if you do stay?
Yeah, I might have another seizure or something.
Yeah, so the risks that could potentially happen is that you might have an internal bleed because of the type of injury you have. That could escalate and you could go into a coma or potentially even die.
Right.
So knowing this information, do you still believe that you want to stay at home?
So I can, if I have a brain bleed, got a look at my brain, do a scan and stuff.
Yeah.
No, I understand all that. Yeah.
Okay. Then you still want to stay home?
And I'd still rather just stay. Yeah, I don't want to.
Okay. Yeah. Well, I do respect that, Scott. But the question I'd ask you is, just so I know that you're fully aware of what's happening, could you just please explain to me back to what the risks are for you staying here?
Right, so I've had a seizure, someone's kicked me in the head during the game. If I don't go, I may have like a brain injury, and possibly another seizure or something, and it would be a risk to my life, but I just can't be bothered to go to hospital, obviously. I'll call an ambulance if I need one.
Okay. Okay then, Scott. Cheers.
Alright, cheers mate.
Autonomy is one of the 4 biometric principles of healthcare. It's the right for the patients to make decisions about their medical care without the healthcare providers trying to influence the decision. Patient autonomy does allow for healthcare providers to educate the patient, but does not allow for the healthcare provider to make the decision for the patient. As seen in this scenario, the patient was able to relay the consequences back to the paramedic, providing assurance that the patient is fully aware of the potential outcomes for deciding to stay at home. For the patient, the next step would be to advise them to go see a GP in the next 48 hours or to call back emergency services if any changes to their current health condition. If the patient did not meet the criteria of competency and was to be believed the treatment was in the patient's best interest, a strategy could be to call or contact a family member to help the patient's cooperation.